Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone to this quick kick. I guess you've picked this one up because you're on your second or subsequent pregnancy and all of a sudden you think, oh my God, my symptoms are so much different to my first pregnancy. Is everything okay? Now, this is really common and it's a question that we get a lot in our Q&As. So we've picked one of the Q&As to talk about whether you can expect that every pregnancy will have exactly the same symptoms, or does having different symptoms in different pregnancies signify anything? Every pregnancy has a degree of symptoms, some of them severe or dangerous, such as high blood pressure or bleeding, and these are subjects of research and have known standards of treatment. But there is limited evidence on why some of the non-dangerous or less severe symptoms occur, or even agreement on treatment methods. I reckon this is where confusion can start. There's a fine balance with putting up with symptoms as a byproduct of just being pregnant, or when it's time to seek treatment. A rule of them for us is to know the red flag symptoms. And we talk a lot about red flag symptoms in our podcast. And we want you to know that they're the ones that you need to seek immediate help for. The symptoms that are impacting your quality of life during your pregnancy, we think you should also seek help for. For example, pelvic girdle pain. This is best treated early, even though you could probably soldier on. So back to the topic. Will your symptoms be the same in each pregnancy? Well, Dr. Pat, in this quick kick, talks all about it. So let's get into it.
Hi, my name's Emily. I am currently pregnant with my second baby. I'm around about 6 weeks, I think. My question is, can you have different symptoms in your first pregnancy to your second, or will the same woman kind of always have similar symptoms? And I'm asking because with my first, I was like bumbling along, everything was good, 5.5 weeks, boom, I was so sick and just felt horrible. Whereas this time feels a bit more like a slow burn, like I can feel the nausea kind of building, but it's just slowly getting worse and it is starting a little bit later. So just kind of wondering about that. Thank you.
Excellent.
It's just a fascination when you're pregnant.
Yeah.
You know, you're fascinated by all the differences, all the similarities, and every little sort of symptom or whatever, if you've had more than one child, you're sort of comparing it. And I suppose that's where all the myths come about, like, oh, you must be having a boy, or you must be having a girl. Yeah.
I think it's just human nature, isn't it, to look for patterns and to sort of talk about and celebrate, if you like, weird things that are happening to you because you're pregnant, and that's a special state to be in. But this is a great question because it's not in the textbooks. But I can tell you from experience that there's no real pattern for most people, and wildly different pregnancies can happen in the same woman and be both normal. So
and maybe both sex, both the same sex. So, none of that is.
Yeah, I don't think anything tells you the sex, but I do think that, ultrasound and a BS test, but not symptoms. I think that people less nausea than last time, and we normally run the ultrasound over that person, so there you go, baby's fine, just be happy. Yeah. Yeah. Because it's there's such a wide range of normal, and not much to be read into the differences.
Yeah, and sometimes if you're having a good pregnancy, you kind of do wait for the other shoe to fall. Like you're thinking that at any minute now I'm going to get all those symptoms that everybody talks about.
Absolutely.
Yeah.
If I'm looking after someone who's had a previous pregnancy loss, and the first sign that they'd lost that previous pregnancy was a loss of the nausea because the hormone levels were going backwards instead of forwards, then of course that person's going to think next time, every day, do I feel sick still? Do I not?
Yeah.
Of course they will. But it's just not a reliable indicator. Could just be a different pregnancy. Baby might be fine.
And I think we've said it before in podcasts, have an ultrasound.
Yeah. So we want people, if they're really, really troubled by insecurity, a lack of, oh my God, I don't know what's going on in early pregnancy, to feel confident to ask for help.
Good luck with those. I hope that you have a very good second pregnancy.
Yeah, good luck.
Okay, everyone. Well, is your second pregnancy travelling along the same as your first pregnancy? For most of us, managing symptoms in pregnancy is a major job while you're growing your baby. If you need any help to sort out your pregnancy symptoms and to know which ones are what we call the red flag symptoms, please consider joining our pregnancy and birth program, Grow My Baby. This is 50 plus weeks of expert help to bring you calm and confidence back into your pregnancy. Check this out on our website, which is growmybaby.com.au, and I'll put all the links into our show notes. That's it for this quick kick. Thank you so much for listening. Thank you so much for being with us. We are thrilled to be on this journey with you of growing your baby. Until next week, bye for now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.